Okay, so this would be an OMT, foot and ankle complaint. So I would start by looking at the knee, and then what you can look for at the knee is if they can like internally and externally rotate. So he doesn't really like to internally rotate. Same thing over here, internal and external rotation. You could also kick your leg out like you're trying to kick me. Do some muscle testing, make sure everything's okay there, pull it back towards the, there you go, pull it back. Push this guy up towards the ceiling. Push this one up towards the ceiling. So you can do that. The other thing that you can do is check out the fibular head. So will you like, just show what I'm doing. So you could just grab that fibular head and see where they want to go. He doesn't really want to go anteriorly, he's going more posterior. And you can do it on this side as well. Just grab that fibular head and kind of glide it. He's still liking posterior, not really like an anterior. And then will you lay back for me and like put your feet where your feet are on the bed. And then for the foot complaint, you can also see which one goes more into dorsiflexion and then plantar flexion. So looks like he's not wanting to go into plantar flexion here, and he's not really wanting to dorsiflex this way. And then you can palpate, looking for looking for stuff in the foot, if anything's tender. So if I was treating this patient, I would probably fix his dorsiflexion because he's not got a lot of movement. He's going a little bit better on his right, so I'd fix his left. So he won't dorsiflex, so he is plantar flexed on the left. So I would put him into dorsiflexion and then have him push down on my hand into plantar flexion because that's his freedom. And then I'd do that, have him hold it, do it a couple more times, and then I would tell him I'm going to use muscle energy to make this foot move a little bit better by putting you where you don't want to go to put you where you want to go. And then I'd reassess, and if the treatment worked, this foot would move a lot more into dorsiflexion.